Hi, I'm Dr. Race with Advanced Chiropractic, and today I wanted to go over what do the adjustments actually do. Our chiropractic adjustments are very unique and specific to your spine. So whenever you come in, we do an exam, we take x-rays of your spine, and we find out exactly where your spine needs to be adjusted to get the pressure off the nerves. We utilize the Diversified Technique, which is a technique that means that we really use a bunch of different techniques to adjust your spine. The adjustments are based on your condition, but also your preference. You may see us using what's called the variable adjuster to adjust your spine. We can adjust the spine with this. We can also work on muscle tissue. You may see us adjusting the spine by hand. And whenever we do that, sometimes you'll hear a popping or clicking noise with the spine. That is not bone hitting bone, that's just little gas bubbles that gets released from the joints. Kind of like if you adjust your knuckles or if you open a Coke, it's just carbon dioxide gas bubbles that form in the joints, and when we adjust, those bubbles come out of the joints. The chiropractic adjustments are initially used just to get the spine moving again. Whenever you first came in, we found that there are some poor movement patterns within your spine. And whenever you have restrictions or lack of mobility in these segments, it'll lead to early degenerative changes. Whenever we perform a chiropractic adjustment, there's a number of things that are happening on the inside. One, you may start to feel better. And the reason you might start to feel better is a combination of getting pressure off the spinal nerves, but also your body is releasing some hormones in your body, which are called endorphins or enkephalins. And these are the pain releasing endorphins, or they help to minimize pain in your body. Another thing that's happening whenever we put a very specific chiropractic adjustment into your spine, there are nerve impulses that go up to your brain, and it actually frees up the restriction on those nerves or the pinching of those nerves. So now your brain can actually communicate to the cells, tissues, and organs of your body easier. Some of the benefits of the chiropractic adjustments are that you're gonna feel better. And that's most people's number one goal when they come in. They want to feel better. So they start to feel better because we get pressure off the nerves. But another benefit is that people actually tell me they start to sleep better. Their energy is up. They have better moods, which all makes sense because if you have stress to the nervous system, it's going to make it very difficult, more stressful in your life. As we start to remove that stress and interference to your nervous system, you're going to notice that you're sleeping better, you're feeling better, your energy's up, your ranges of motion, your movement patterns are improving. So those are just some of the benefits with the chiropractic adjustments. There are different phases to the chiropractic care you're receiving. The first phase of care is really just designed to help you get out of pain and help you start feeling better. Once we get enough pressure off these nerves where you start to feel better, now the goal is really to start correcting the spine. Now that takes time. You can think of this like braces on teeth. So if you went to the dentist and your teeth were out of alignment, and they recommended that you needed 2 years of braces to correct the teeth, you can think about the chiropractic adjustments a lot like that. So we're adjusting the spine, not just to get you out of pain, but to correct the alignment so that you stay out of pain. Now, along with that, your muscles have to stabilize, your spine has to stabilize. We have to retrain tendons and ligaments to help correct these postural weaknesses and help get the pressure off the nerves and keep it off the nerves. Now, depending on what condition you came in with, it really depends on how long the chiropractic care will take. So of course, number one goal, help you get out of pain. However, fixing these conditions do take time, right? And getting pressure off the nerves and allowing these nerves to heal, it does take time. So research says once you get pressure off the nerves will heal over time. So for example, if I have a pinched nerve here, and it's causing symptoms all the way down to my fingers, the nerves heal at 1 inch per month. So once we get pressure off the nerves here, think about how many inches it is all the way to my fingers. So now, it doesn't typically take 3 years to completely heal a condition. However, just to put it in big picture, realize that this process does take time for the nervous system to heal and for those nerves to regenerate properly. Now, I mentioned some of the techniques do require your spine to pop and click. And that popping and clicking, once again, is just the little gas bubbles that build up in your spine. They're getting released out of your spine whenever that happens. It's not bone hitting bone or anything like that, right? Now, whenever you do start chiropractic care, a lot of times there is some initial soreness with the care. Think of this like if we went to the gym. Let's say we hadn't gone to the gym ever before or in a very long time, and we started going to the gym, we started working our muscles. You know, for the first couple 2 to 6 weeks, we could be getting really sore because we're breaking down the muscle tissue and it's rebuilding, right? Whenever we're moving your spine around and shifting it, there could be some initial soreness for the first few weeks of your chiropractic care. So once again, I'm Dr. Race with Advanced Chiropractic. If you have any other questions regarding your chiropractic care, please don't hesitate to ask us on your next visit. Remember, we work for you, and we would love to answer those questions so you have a full understanding of what's going on. Thank you, and I hope you have a blessed day.